Welcome back to the channel. Today we're looking into one of the most important biomarkers in systemic lupus erythematosus, or SLE, the role of double-stranded DNA, or dsDNA, and its antibodies. Whether you're a medical student, a resident, or just someone curious about autoimmune disease, this comprehensive breakdown will guide you through everything you need to know. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Let's begin by understanding what double-stranded DNA actually is. Double-stranded DNA is the fundamental form of DNA found in the nuclei of all living cells. In a healthy body, this genetic material is tightly contained within the nucleus, far from the immune system's surveillance. But in autoimmune diseases like SLE, this barrier breaks down. In lupus, when cells die, especially through processes like apoptosis or netosis, they release nuclear material into the surrounding environment. If these nuclear remnants, including dsDNA, aren't cleared properly, the immune system may start to recognize them as foreign. This leads to the production of anti-dsDNA autoantibodies, a central feature of lupus. These antibodies bind to circulating dsDNA, forming immune complexes. These complexes can deposit in various tissues, most notably the kidneys, triggering inflammation and damage. And through the activation of innate immune receptors like toll-like receptor 9, these DNA-containing immune complexes further fuel chronic inflammation. First, anti-dsDNA is highly specific for lupus, even though not every lupus patient will test positive. Second, antibody levels often reflect disease activity, especially in patients with lupus nephritis. Third, these antibodies are directly involved in organ damage, especially when immune complexes lodge in the kidneys. Lupus nephritis is the most common serious complication of SLE. There are several ways to test for anti-dsDNA antibodies. ELISA is great for screening but may detect low-affinity antibodies, more prone to false positives. FAR assay uses radiolabeling to detect high-avidity antibodies, very specific. Crithidia luciliae immunofluorescence uses a protozoan's kinetoplast to detect only high-affinity anti-dsDNA antibodies, highly specific. High titers strongly suggest SLE, particularly in the context of renal involvement. But remember, a negative test doesn't rule out lupus entirely. Anti-dsDNA antibodies are more than just diagnostic. They're also useful for monitoring disease activity. Rising titers can indicate an upcoming flare. Falling levels may reflect response to therapy. Complement levels, especially C3 and C4, are often tracked alongside. When lupus nephritis is suspected and anti-dsDNA levels are elevated, treatment may include corticosteroids, mycophenolate mofetil, glufosinamide, biologics like belimumab. Rituximab, which targets B cells, may be reserved for refractory cases. To wrap up, here are the main points. Anti-dsDNA antibodies are highly specific for lupus, especially with kidney involvement. They are involved in disease pathogenesis by forming immune complexes that trigger tissue inflammation. They help monitor disease activity, with titers often rising before flares. Their presence may guide the use of immunosuppressive therapies. If you found this deep dive helpful, please give it a like. Subscribe for more rheumatology content. Drop a comment if you have questions or topics you'd like us to cover. Thanks for watching, and as always, keep learning and stay curious.